Next speaker, Richard Haddad. He's got his bachelor's degree at Wayne State, his MD in London, his residency at Albert Einstein in Montefiore Hospital. He was a fellow in rheumatology in New Jersey at the Robert Wood Johnson School of Medicine. He's clinical assistant professor of medicine at Robert Wood Johnson. He's run a number of ultrasound courses. He runs the one for Albert Einstein, Thomas Jefferson. He's involved with the American Institute of Ultrasound and Medicine annual conference. He's going to give a talk actually there Sunday that's going on this same time. He's also been involved with ULAR in their conference, and he's going to talk today about musculoskeletal ultrasound in rheumatology practice, and then we're going to have a hands-on session.
Thank you. And hopefully I can get you excited about ultrasound and so you can employ it in practice. So I was going to use Dr. Richland's arm, but he didn't sign the HIPAA evaluation form, so I used Dr. Arnold Schwarzenegger from California. But what I'd like to do is try to get you excited about musculoskeletal ultrasound and using it in clinical practice. And it's been used as a European tool, but over the past 10 years, it's been getting, rheumatologists have been getting interested in it because of its utility and the usefulness in practice guiding injections and doing on-site diagnosis. So we're going to go through some cases. I'm going to show you what I do in clinical practice with ultrasound. So when you look at this, this is a little bit daunting, so it's overwhelming. It looks like just a black and white signals, and you're not sure what's head, what's tails. But hopefully at the end of the talk, you'll feel comfortable diagnosing and picking up these structures to help you with your patients. So two different approaches that I use, what I talk about. One with the radiologist, one is the rheumatologist, as we are. We like to focus on pathology versus the radiologist focus on anatomy. How many times you send a patient for an X-ray or an MRI and you want to know about the erosions, you want to know about synovitis, but they just tell you it's no fracture evident, and that's your information for that day. So I said, you know, is there a way that I can get more information when I have the patient there in the office, when the patient says I have pain here, particularly when I lift up my arm? So with ultrasound, I can use direct imaging with the clinical examination. So I consider it as the extended finger of the clinical examination or the stethoscope for the rheumatologist. I also consider it as the rheumatologist, Superman's X-ray vision. My wife told me not to do this, but I did it anyway. I spelled rheumatologist as rheumatologist, that's X-ray, but it's pretty corny.